Mountain. I'm living in a constant state of confusion. Give me the green light to go back to jumping on the ice. I don't know when I'm gonna get there, but I know that I'm gonna be okay. I finished my anti-inflammatory pill yesterday. I'm getting close to deciding whether I want to go back in for the cortisone shot or not. We're doing the cortisone shot. I don't know how to feel about it because of course it scares me. I guess having to do the cortisone shot means that there is not enough progress to avoid it. At the same time, I feel like it's a good thing because it's gonna be diagnostic and we'll know what's causing this pain, maybe. Or we'll be able to discard at least a couple of causes of the pain. So I think, rationally speaking, it makes sense. At the same time, it's a little bit defeating to know that I actually need to get it. I'm not a fan of cortisone, and I'm sure a lot of you can understand that feeling, but I'm not gonna do it every day. I am not doing it. Well, this is my second one in 5 months, but but again, this is not a long-term solution and we need to know what's going on in there, so we're doing it. In the meantime, we are doing some dry needling on the left hip, like in this area here, to help with the soreness, and I do feel better, but it's still bothering me. I guess that's where the decision comes from. We're going back in. And just to remind you, if you didn't watch the video of the 9 months, the idea of doing the cortisone shot is more of a diagnosis thing than a treatment. What I understand, please take this with a grain of salt, is that we will put the shot around the labrum, and if that calms the whole pain down, then it means that the labrum is actually causing the pain of the tendon, because that's what I am in pain for. The tendon is the one that's causing the pain. If it doesn't calm down the tendon, I don't know. We don't want to think about it yet. So that's the reason why we're doing the shot. I fell on the ice. I fell on the left hip. So I don't know if it actually counts as falling on the ice, to make sure that the other hip is not gonna break in half. But I'll take it. Like, you know, it's my first fall on the ice, even though it was on the left hip. And I didn't break in half, and I am very happy about that. I'm really happy that it finally happened. It wasn't a bad fall. It actually didn't really hurt, and I think that was the best way of falling for the first time. So I fell on the ice, and it was just so crazy because like I felt really good. Like I'm fast. I was practicing my spins that were not spinning, and then I was practicing my jumps, and at the very end something magical happened. A coach approached me, which never happens in the skating world. Like those things that you watch in the movies of like the coaches trying to poach people, that usually doesn't happen. You usually have to find the coach. At least that's what I have learned with my experience. So I never thought, and especially, you know, like someone like me, I never thought that like someone would think that I have potential to like approach me and tell me that we could train together. That was super crazy, and I don't want to invalidate this moment. So if you are thinking that maybe he's just a good business guy and that's why he wants to work with me because he wants more money, think whatever you want. I am super excited. I am super happy because I never thought that something like this was gonna happen. Overall, it was a really good day. And I'm glad that it was a good day because I actually couldn't sleep last night after I sent the email to do the appointment for the cortisone and just making the decision that we are doing the cortisone shot. I guess I'm uneasy. I'm feeling a little bit anxious, of course, so I didn't sleep. Like I was up for a significant time in the middle of the night, and that wasn't that great. But today spirits are higher. Hello everybody from the headquarters, which is the parking lot of the hospital. I got my cortisone shot done and I am ready to see what happens. I think today is a very important day in the sense that we are putting an end to this chapter. However, the end looks like no pain anymore. We know what the heck is going on with my hip. We end this uncertainty. Whatever this looks like, we're putting an end to this situation today. So we're gonna see what happens. the whole process was really similar to the other cortisone shot that I got in the surgical leg. With the ultrasound machine, the cortisone went directly into the labrum, and I confirmed with the medical team if my understanding of what we're doing is correct, and it is. We're using this as a diagnosis to see if the labrum is causing the pain in the back. So let's imagine a decision chart. So we have the cortisone, and the first scenario is that the pain goes away, which means that the labrum was causing the pain in the back of the hip. Scenario 1.1 is that the pain goes away and never comes back, and I live a pain-free, healthy life. Scenario 1.2 is that the pain comes back, and I will have to figure out what to do to manage that, which from my perspective should be just surgery. Scenario 2 is that the pain doesn't go away, and then that would mean that the tendon or the glute is the one causing this pain. And they didn't seem to be as concerned about that. They were like, oh, we'll see what happens. We'll play it by ear. We'll find some measures to treat and manage that pain. So I guess we'll see. Something that is really interesting from visiting them is that they are so positive and they are so sure of what they are doing that it gives you this confidence that like things are gonna be okay, that everything is okay actually. And look at me, I just got a cortisone shot and I am in a great mood. Like, how can that even be possible? I am a little bit confused. It is this vibe that they have, and I appreciate that, one, they are not only positive, but two, that they are sure of what they are doing, which gives you a lot of peace of mind. So we're basically playing it by ear. It looks like now they are a little bit more sure that it's the labrum causing the pain. And another piece of information that I gave them today was that I think I might have overdone it in physical therapy yesterday. We were using a machine called the multi-hip, which is basically weights, and you move your hip in different directions. You open the leg, you close the leg, you bring the leg up, you lower the leg, and all of that with weight. And I might have used a lot of weight, and like I was able to do it, but I think it might have been too irritating for the labrum. So today is the first day ever that I have significant labrum pain. It's weird because it's so painful that I can't even feel the pain in the back anymore. And they were telling me that that might be a good indication that it's actually the labrum causing the pain everywhere. After the cortisone shot, 5 minutes after, the pain in the labrum decreased drastically. But now that I'm walking, I feel it again, so I guess it was probably because I wasn't moving a lot. But that was an interesting thing to see. I guess just important information, probably the labrum giving me signals that that's what's going on. So I have a pain diary again, and I have to send it back in 7 days. And basically the idea here is that we're gonna play it by ear, 1 day at a time, and make decisions based on how my body reacts. So fingers crossed that everything is gonna go well. As I said already, I know I'm gonna be fine. I know I'm gonna be okay. I just don't know how I'm gonna get there. But I know that I'm gonna be okay. It's been almost 11 hours since the shot, and I feel horrible. Horrible is an understatement. I am in so much pain. It's ridiculous. I can't walk without pain. I have pain in the hip groin, in the knee, in the calves, in the heel, all in that left side, and it feels absolutely miserable. I have a little bit of a mix of, as I said, a pain of being sore because of the gym, because the other groin also hurts with that kind of pain, and then I guess the pain of actually the labrum being super irritated, and I feel so bad. I'm in so much pain, and I really hope that tomorrow is a better day, because today has been crazy. Like, I've never had this amount of pain in that side of the hip ever, and it's scary and defeating, and I really hope that tomorrow I feel better. Morning. Today is the morning after the shot, and words cannot describe in how much pain I am right now. Like, it's ridiculous. It's kind of an acute pain, like, think about music. I would describe it as a high-pitched pain, as opposed to the other side, the surgical side, that is more of like a low-pitch pain, if that makes any sense. It's really acute. It's like someone was stabbing a knife in it constantly. Like those voodoo toys. You're stabbing the needles. That's how it feels, and I am very, very tired because pain just like consumes you. And my legs hurt, like the whole leg hurts. Like if I had run a marathon or something like that, I am in just so much pain. So I'm gonna take a Tylenol. I'm gonna eat some breakfast, take the Tylenol. And something really nice that happened is that one of my neighbors saw me walking like a gorilla and she brought me this, which is adorable. It's like aromatherapy dough. So it says a scratch and a sniff. She said that I should use them, you know, I guess it's just supposed to like help you relax or something. So I think that was super, super cute. Hopefully pain goes away. I can't walk with no pain. This is insane. This is ridiculous. Good morning. Today is day 4 since I did those exercises that triggered the labrum, and day 3 since the cortisone shot. The pain in the outside of the hip is bad. You know, I don't even know what I should be rooting for or what should I be hoping for. It's like very confusing and very difficult. Let's start yesterday, because I talked to you yesterday, and then after that I was supposed to go skating. And I asked my PT the day of physical therapy, I was like, oh, can I go skating tomorrow? And he looked at me and he's like, let's make this a rule. If you cannot walk like a normal person, you shouldn't be skating. And I was like, okay. But yesterday I thought to myself, oh, life is too short, I should just go skating. So I was ready. I had everything ready, and I walked my dog before leaving. And then when I was walking, I realized that my labrum was still in pain, so I figured that I shouldn't be that irresponsible, so I didn't go skating. Very proud of myself. Then I just took it easy during the day. The pain in the labrum started to fade down, and today it's really, really minimal. I would say probably like 10% of what it was in the past. I also think it is that, you know, like it's been only 4 days since I did the exercise, so like that soreness of actually exercising is also gone. And we went on a walk this morning to the park, and I felt the pain in the outside of the hip, my pain in the back. Again, I don't know, because like today is supposed to be the day that the cortisone starts to kick in. I don't have any pain in the labrum anymore, but in theory, if the labrum is causing the pain of the outside of the hip, then that pain should start going away as well. And I don't know. I also think that the pain in the labrum was so strong, which I have been saying already, that my brain couldn't feel the other pain, because it's the pain that I've been feeling forever. So now that the labrum pain is gone, I guess I'm back to feeling the other pain. We'll see how it goes. I'll keep you posted. I feel like the next days are gonna be super important to see what the heck is going on in this hip. And here we are, 7 days after the cortisone shot. In theory, 7 days was the time that we needed to diagnose whether the cartilage, the labrum, is causing the pain in my butt. However, I don't feel like I am ready to give you any answers yet. So I talked to you on day 4, explaining that the original pain came back, the pain here, and that lasted throughout the whole day. In the evening, I remember I went on a walk and it was so painful. But then the next day, that pain went away. Everything went away. Like I was pain-free on day 5. But then day 6 and day 7, I've been feeling better, but I feel the pain. Still know that there is something wrong here. And if I touch it like this, it feels very painful. So it is still tender. It's not gone 100% yet. So I don't know. I feel like we need a little bit more time to make a judgment and a diagnosis. I have to send some updates today to my doctor, and I will tell him everything that I am telling you. But I apologize, this video is gonna close without you knowing what's gonna happen, without me knowing what's gonna happen. So you guys are gonna have to stay tuned for month 11 to see what's going on. So just subscribe if you are curious to see what's gonna happen with this hip. But in the meantime, I can tell that the pain has gone down. So we'll see what happens. We'll see how this improves. And we'll keep working on strengthening and dry needling. And if the pain improves, little by little, go back to my activities. It sounds like I've been skating for a long time, but I actually only have skated like 3 times this month, which is really, really sad. It's really, really low. So I used to skate every single day. And then I guess the other thing that I wanted to tell you, which is a super interesting thing that I learned, is that when you have pain, your body shuts the muscles down. So for example, I don't feel as strong or as agile in my left hip or in my left leg as opposed to the right leg. When I'm skating, I don't feel like that leg is gonna hold me together or that it's safe to be on. And what I learned is that potentially my brain has shut down the muscles around it. So when you have an area that is in pain, usually the body shuts it down so you can rest and it can affect the area, which is really, really mind-blowing. It's very interesting. So we're hoping that with all these different things that we're doing to help with the pain, the muscles are gonna wake up again and we're gonna be able to continue strengthening, which is the most important thing for this condition that I have in my hip in general. You know, just like being strong is super, super important. So very interesting how pain works and operates in that way. And talking about pain, I do want to touch base on the other hip because there has been a lot of talk about this hip, but the other hip is the reason why you guys are following this whole journey. And I am very pleased to tell you that the right surgical hip is doing great. It has been painful every now and then, especially these past days. I think since the time that the other hip was in a lot of pain in the groin area, this one was also firing a little bit. So it has been painful in the past 4 or 5 days. It's that kind of like dull, crampy pain. I did have one day, and this was before everything, like a week and a half ago, where I actually felt like cramping here. It was really, really weird. So we needled this hip as well. And then the pain that I've been having right now is kind of like that sensation that you all know of something being stuck in there, and that like that causes a little bit of like it, I don't know, rubbing, it doesn't move that well and it hurts. Like that's the kind of pain that I've been having. In my last physical therapy session, my PT spent a bunch of time just moving it. He said that it's normal, that it gets irritated. We haven't done a lot of work on that one because we're focused on the other hip. So he did a couple of moves for a long time. And then when he externally rotated it, it went pretty much all the way, which I was super excited with because that's one of the things that I am trying to work towards, and that was really, really great. If you are in the first months of this surgery, of this recovery, be patient and have faith because things get better. I am feeling way better, and these videos will be completely different if it wasn't for the left hip, because the right hip is doing great, it's doing a good job, and I am very, very satisfied with the results on that department at least. So that is really good to hear. And the last thing that I wanted to share with you was that I was talking to some coworkers yesterday who have gotten a membership to one of these recreational places that have like a gym and a pool and all these things for you to go work out. And we're talking about how they disliked this class and now they're going to choose this one and they are going to do this and they are going to do this. And one of them signed up for the membership and hasn't gone in like 3 weeks and all of that. And there was a moment of darkness in my heart where I was thinking to myself, I wish I had the luxury to choose not to exercise or to choose not to go to this class and choose to go to the other one. And I don't. It feels really sad. I don't have that. Like, I wish I could do all of these things that they don't want to do, but I can't yet. My body is not ready for it. I am just mentioning this because I'm sure that you can resonate as well. I think it also gives us the opportunity of realizing how much we have and how much we take for granted. I think in general, like even us that are not able to like move a lot and that are not authorized to like go pursue a marathon or a Pilates or Zumba class or whatever it is, even as we have a lot of things that we're taking for granted. So this is just an invitation for all of us to remember that there are a lot of people who would do anything to have what we have, to have this freedom to choose to do something versus not doing something, and to value those opportunities that life gives us. You know, this luxury of choosing, this luxury of doing something versus doing the other, when some other people cannot do that. And we'll get there. It's gonna happen. We just need to be patient, put in our work, and just hope for the best. We'll get there. We'll be able to choose one class over the other at the YMCA or something. But for now, we need to be patient. So this is the summary of month 10. Thank you so much for making it till the end of the video, and stay tuned for month 11. I send you a big hug. Thank you so much for watching. Bye!